Getting a good night's sleep isn't easy for everyone. For some, sleep disorders can be dangerous and even deadly. Bob Bahanian explains how one Berkeley County man's lack of sleep almost cost him his life. That's in today's Health Watch.
For the last 2 years, Stephen Hood hasn't had any trouble falling asleep. His sleep disorder makes it hard for him to stay awake.
I could go to sleep anytime I laid down, taking sometimes up to 2 or 3 naps per day.
Stephen wouldn't just fall asleep laying down. It would happen during everyday activities.
Would fall asleep driving, run off the road, and wake up.
Luckily, he was never hurt, but falling asleep at the wheel was the wake-up call he needed. 5 weeks ago, he spent a night here at Roper Hospital Berkeley's sleep lab.
See how fast the EEG movement is right here? You're awake.
Karen Rollins is the lab's clinical co-coordinator. She monitored Stephen during his stay.
So we can actually tell when the patient has gone to sleep, at what point they are in their stage of sleep, and when they wake up. So we're measuring all that at night.
Stephen's tests diagnosed him with sleep apnea. Now each night he sleeps with a mask that's hooked up to a machine that gives him nasal CPAP therapy.
It sends out a constant flow of air. It draws in air from the room and sends it out at a high flow.
He now sleeps better at night, which means sleeping less during the day and never behind the wheel.
I feel much more rested, when I get up.
Roper Hospital Berkeley opened back in 1992. The sleep lab here opened just 30 days ago. So now patients from Berkeley County don't have to travel all the way downtown to get help with their sleep disorders.
We realize that there is such a prevalence of sleep disorders in the community.
Bob Bahanian, Live 5 News.
More than 40 million people a year suffer from sleep disorders. Symptoms include blocked airways, insomnia, grinding of the teeth, chronic fatigue, and daytime sleepiness. A new study out of the National Heart, Lung, and Blood Institute has linked obstructive sleep apnea to the potentially deadly condition. Researchers found it more than doubles the risk in men while also raising it for women. Obstructive sleep apnea happens when the upper airway is narrowed or blocked, disrupting breathing during sleep. Researchers think the gender difference may have to do with men typically developing sleep apnea at a younger age and therefore going longer without treatment.